Hi, I'm Dr. Miller-Parish from Scotland County Hospital. I want to let you know about a few new changes we're seeing in colon cancer. We're seeing a marked increase in the occurrence of colon cancer in younger patients over the past few decades. Currently, 1 in 5 people will be diagnosed with colon cancer under the age of 55. For example, in 1995, only 11% of colon cancers were under the age of 55, but it has increased to 20% being diagnosed under the age of 55 by 2019, which is part of the reason they increased their recommendations for making colon cancer screening start at age 45. We're also seeing more advanced cases in the younger people, partly due to not being screened and not recognizing the symptoms of early signs of colon cancer. So some of the early signs of colon cancer are blood in the stool, a change of bowel habits. Good news with this, after all the bad news about young people, is we're seeing less colon cancer in older people over age 65 because they're being diagnosed, and with a screening colonoscopy, they're removing the polyps that will grow into a cancer. A colon polyp will grow for about 10 years in the polyp stage before it becomes a cancer. So colonoscopy is a way to prevent cancers. It's one of the few cancers we can prevent with colonoscopy. We recommend now that you start screening colonoscopy at age 45 and do it every 10 years unless you have a family history of colon cancer, and then we recommend 5 years, or if you have polyps, or if family members have polyps, puts it in the same category as a colon cancer. Other screening methods for colon cancer include FIT testing or stool DNA test. These can be done at home, where you collect a stool sample and then you bring it back for testing. A FIT test will check for blood in your stool, and this can show up when you have a large polyp that's irritated by the passage of a bowel movement, and they will bleed and leave the blood in your stool. If you do FIT testing, it should be done yearly. And if you have a positive FIT test, you need to follow up with a colonoscopy to clean out any polyps or just see what's really there. There are a few false positive and negatives with these other stool tests. A stool DNA will evaluate the stool for DNA that we see in the polyps. And this should be done every 3 years. And like the FIT test, if you're positive with this test, you need to follow up with a colonoscopy. Neither the FIT test or the stool DNA will remove the polyps, but will tell you if you need further evaluation. So you do need to follow up and have those polyps removed. Half of all the colon cancers that we see are related to factors in your lifestyle that you can change. Some of the risky factors are smoking, an unhealthy diet, high alcohol intake, or lack of physical activity and excess body weight. Look to us at Scotland County Hospital and Clinics for your colon health needs. I will always make time to talk with our patients about our services. Thank you.